was a woman who was in her 70s. She had maybe dementia. I'm not sure of her diagnosis, but I knew that she was confused. But the nurse's aide that was working with her came to get me. We were going to go in and do an assessment, do vitals, and the patient's hair was not combed. You could tell it was not combed since she's been there, that it was matted on her head, that there was no way we were going to get a comb through her hair. So we had to cut her hair off. And in the Black community, hair is very important. Hair was always something that we had control over. We could straighten it, we could leave it natural, we could braid it, but regardless, we needed it clean because it represented who we were. So to go in a room and see someone who was, at that time, my grandmother's age, not have her hair combed, to me, it was like it was a form of neglect. Because, and again, it was one thing if all patients were treated that way, but I could actually, at this time, we could write a nurse's order to have a patient go to a salon in the hospital to get a press and curl, or to just get a wash and go or whatever. So they were doing that for white patients. Their hair was crazy. We just wrote a prescription, they went down. But for Black patients, they weren't given that same treatment. So that's when I started to realize that patients were being treated differently. And that's only the physical aspects of it. But when you also look at how they were getting certain tests worked up, how they were treated when they came in, automatically it was considered substance abuse if a patient of color came in. So we got to do a drug screen and see what they're on. And then we had patients that came in that I'll never forget this one patient, because she kept me up all night, which that was my job, so I'm not complaining about it. But she was very confused. She kept me up the whole night. And they were like, oh, maybe she had a stroke, maybe she's having dementia. I came in the next morning, she was gone. And they were like, oh, she was addicted to Valium, so we gave her Valium, she was fine, and we sent her home. And I was like, but if that was a person of color, the police would have been involved, so the social worker would have came. So that's when I started to see those system issues. But honestly, at the time, I still couldn't name it. But I knew that that's when I started to really see discrepancy in care, and even how we treated patients when they were dying. There was more love and passion when someone else, it was almost like a person of color, like they didn't have a family. It was like something was always missing in the care that was provided. They weren't treated with the same respect and dignity.
I had a family member who was incarcerated for not paying child support. And when he came out, he found out while he was in that he had high blood pressure and diabetes. So they gave him like a month's medication, but because he couldn't get a job, he couldn't get insurance, he never filled the prescriptions, never followed up with a provider. His blood pressure went through the roof, so the hospital admitted him. He's in the hospital now, and maybe for a week, they get everything under control. And then I go there to pick him up, and the nurse gives him about 10 prescriptions. And she says, you have to take this for your blood sugar, you have to take this for your blood pressure, and you have to get a glucometer so you can test your blood sugar. And then all of a sudden, she leaves. And I said, how are you gonna get all those filled? You don't have any money. And he says, I don't know. I said, you realize you're gonna be right back here if you don't do anything about your condition. So I go back outside and I share with the nurse. I said, you just gave him all these prescriptions. Did you ask him how he was gonna get these filled? If he had the ability to get these filled, if he understood what you were saying, how important this is? And she just looked at me. But I just felt like, wow, how many patients don't have someone advocating for themselves and won't speak up because they just think this is what you're supposed to do and no one's gonna help them. And unless we ask the individuals, tell me about what you're gonna do, what your needs are, if we don't have those conversations, most people are not going to offer it.
A lot of the misconceptions that are written about us are racist, about how we are, that we're aggressive, that we're not very intelligent. My experience as a nurse, and I had to learn this on my own, is I would have 2 different doctors as an ICU nurse, and they had the same type of patient that was on the vent. And one doctor, I asked him, well, why are you giving this medication? Just because I want to know for myself. I just like learning. That's always one of my things, is always to ask why. And he got so upset and he began yelling at me. Don't question me. Why are you questioning me? And so, yeah, just let it go. The other doctor, and this was after Hurricane Katrina happened, so he was one of the doctors that came over to help us for a few months. And he had the same kind of patient, and I asked him the same thing. Why are you doing this? Why are you giving this kind of medication? And he just went into teaching mode. He just said, well, I'm going to do this to see if this will do this, change this. And so after that, I realized it's not me, it's them. It's how they want to be healthcare providers. And I'm just asking because I want to know. I just want to learn. But the experiences I've always had is, why is this brown person asking me a question? And it's never thought of as, well, let's just go into teaching mode so I can help her learn.
Actually happened around the time that we were starting our program, and it was a Latino physician who was of Mexican-American descent who was on the consulting service for internal medicine. The patient was a surgical patient who was post-op day 0 or day 1, and he found was writhing in pain with increased heart rate, not conscious but moaning. And he asked the nurse, who happened to be black, it could have been any one of us, it seems like she's in pain. Do you think she needs more pain medicine? And the nurse said, no, I don't think so. He said, wow, really? And then he went through the data points, what we call signs: increased heart rate, physical agitation. And she said to him, look, I had the class on Hispanics. I know they overexpress their pain that they're suffering, so you don't need to pay as much attention to pain control in them. And it was really sobering for us, because here's a Latino physician with a Latino patient who's trying to point out to you something. You're not listening. And you're really not looking at the clinical data, right? You're looking past all that to a stereotype, a static depiction of an entire group of people to decide what to do with this patient right now in ways that are contradictory to even your nursing training, right? So again, that idea, the confidence that we're so internalized to have, and we absolutely have to have, if you're going to put in an IV, do a lumbar puncture, hang a drip of dopamine, yes, absolutely. You need to feel confident and clear that there are right and wrong answers. But for this, where we're historically scripted to stereotype people and to prioritize our mastery, technically, that patient is at risk.